So this question comes from Kat Ellington, who's a medical student from Queens, and she wants to know what innovative practices, what innovation practices do you see in community development?
Where's the action in innovation these days?
I mean, I would say, two things. One is that, I was asked that same question, or somebody from our sector was asked the same question by somebody from the banking sector. Where's the innovation among CDCs? And the session ended, and I wanted to say that if we weren't so busy cleaning up the messes created by the financial sector, we might have time for more innovation. So a lot of our innovation is around trying to clean up messes that someone else creates, whether it's natural forces like Sandy or man-made forces. I say man, that was gender specific because it's pretty much true. Man-made crises like the 2008 recession that we had that still is harming people. But in terms of innovation, I really see the CDC 4G thing as innovation. There is a culture in the sector, and not only is there a culture, every neighborhood has a culture, every board has a culture, every organization has a culture. And the fact that we are coming together and saying, let's combine our resources to have a better effect, a beneficial effect on our neighborhoods, I think is a major innovation, which is why we're calling it CDC 4G, because we're looking at a fourth generation community development model. So I see that as an innovation.
I think in addition to the 4G, which I agree is absolutely an innovation,
I think it really has to do with the issues of equity and issues of justice. Obviously, when thousands and thousands of people are in the street in multiple cities across the country because of the effects of racism are alive and well, and when it comes to policing or in terms of economic outcomes, I think the innovations have to do with linking people to opportunity. I think it's on the human capital side. I think it's going deeper on the human capital side, in addition to ensuring that we're good shepherds of the assets on the bricks and mortar side. So I think it really has to do with that.
I think that's a great question. And, the R&D budget that the typical CD has is zero. So those companies known for innovation have much more substantial R&D budgets. You just don't innovate. You think it through, you test, etc. What we have done is we had decided at a policy level that we would not operate a program that has not been evidence-based tested. Not by us, by somebody. And so we've been adopting program models that have been tested by other folks. And so the other thing that we've done in terms of managing our business is to look at the for-profit sector to see what management tools they use. So we recently took a bunch of our people through Six Sigma training. We're in the process of hiring a consultant to help us with micro-targeting, a specific census tract so that we know everything that we could possibly know about the households in that census tract so that when we approach them, we'll segment them by type and have different messages for communication to reach different households. So there's some proven, so that might be considered innovation. I think the other thing is that both Bridge Street and Pratt Community Council have agreed to integrate their performance metrics with ours. So we're building a Salesforce dashboard where they'll be able to import their performance metrics that they report to their funders to one dashboard that we can all look at. We can know where people are working and what results they're having. But then the infrastructure will also be longitudinal, so we can capture what's happening to a family, what is going on in a family over time. So I think part of it might be adopting proven practices from both the for-profit and nonprofit sector and merging them in our everyday operation.
And just sticking on the topic of data for a minute, Michelle, do you want to talk a little bit about Change Capital Fund and how you're looking at measurement and evaluation in that effort and what Change Capital Fund?
Don't say Change Capital. We were not awarded, and I still am carrying a grudge about that.
Well, we're one of the fortunate 5 groups that was selected for the Change Capital Fund, which is a fund made up of 17.
The fortunate 5?
The fortunate 5, yes, F squared, I guess. So for Fifth Avenue committees, we decided to have a collaborative approach to reducing poverty, focused on public housing residents in Red Hook and Gowanus. Basically, it's 5 different housing developments: Red Hook, East and West, Gowanus, Wyckoff, and Warren Street houses. I already mentioned the AMI in Red Hook for a family of 4 is just a little over $15,000. And so we're partnering with our own workforce development affiliate, Brooklyn Workforce Innovations, plus Red Hook Initiative, which is a youth development organization based in Red Hook, and Southwest Brooklyn Industrial Development Corporation, which does business services to the industrial businesses in Sunset Park, Red Hook, and Gowanus, in addition to doing direct job placement. And our model really is similar in many ways to what Colvin just said. It's, each of the organization has areas that we specialize in. Fifth Avenue Committee with our adult education and literacy, and our wraparound access to benefits, entitlements, and financial counseling and coaching. BWI with the sector-based training programs in 6 different sectors of the economy, linking 750 linking and placing about 750 folks a year into living wage jobs with career ladders. RHI, obviously, on the youth development side, and SBIDC with the access to employers. And really, it's to take all of our existing award-winning and proven programs and models and linking them so that there's no wrong door. Basically, someone can walk in to any of our organizations, or we can walk up to them, knock on their door in one of the developments and say, let's talk about what you need, whether it's education, whether it's employment, whether it's job training and placement, or whether it's benefits access, and we have common metrics, common measures, and we're also going to be using a Salesforce model. So it's a pretty significant shift for us, because we'll be the hub with the 3 other organizations, and it'll be a significant capacity building endeavor for us, not only to track our own outcomes, but also to have agreement and alignment among 3 separate partners. Herding cats, but in a good way.